Generally, we won't see colonization from oral bacteria in the gut in a healthy patient. And as you mentioned, we have a whole lot of defenses, and that's the reason why. We have physical, chemical, immunological barriers that prevent that. What's interesting, though, is when we see patients who have inflammation or are on certain medications, that can actually make the gut more permeable to these hundreds of trillions of bacteria that we're swallowing every day. And so that's when we can actually start to see some of that relationship or start to see some of that similarity, which can be a red flag. So when we are seeing a lot of similarity between the gut and the oral cavity, that can point to something that we might want to investigate deeper.
Brian, welcome to the Root Cause Medicine podcast.
Thank you so much for having me. Honored to be here.
I'm really thrilled to talk about Bristle Health. So, we have just partnered up, Rupa and Bristle Health, to change the game in oral microbiome testing. And I think a lot of our doctors are wondering how they can apply this clinically and get great outcomes with their clients. We are going to cover that and much more today. But I actually want to start by asking you, tell us the story about Bristle Health. How did you end up co founding this company?
Yeah. So, wouldn't it be your first choice for someone to start an oral health company, especially if you saw my dental x rays? So, my background was actually in the genomics and genetic space. So, spent the last decade working at companies who actually manufacture DNA sequencers and other genomic technologies. And me and our co founders, we were always looking for different ways where we could apply this technology to really solve somebody's problem. Um, and a little background on me, I'm someone who has always struggled with my oral health, where despite doing what I thought I was supposed to be doing, I would always have some new cavity or some new gum issue when I went to my appointment. And, at the time, at home tests were really exploding. I could wear a continuous glucose monitor and test my gut, but I had no way to really get to the root cause of my own problems, my oral health problems. And knowing what we knew about next generation sequencing and what we could do with analyzing the microbiome, that really was an aha moment for us that we should be able to apply these same technologies to the oral microbiome and hopefully give patients and practitioners insights to better manage disease.
And you've definitely been able to do that. And I actually want to start off with some of the proof because I think if people haven't used this test, they haven't seen it before and after, right? So can you speak to, when somebody gets the results back and then they do an intervention that's designed to change their oral microbiome, are they actually going to see changes in their microbiome and changes in their health picture as a result?
Yeah, so it's a great question because obviously you can test, but if there's not the results, it's just information. So, little background on the test. What we're looking for is the complete oral microbiome. So, I imagine most people here know microbiomes, but just to reiterate, that's the community of 800 plus bacteria, fungi, and viruses that live in the mouth. And historically, we've taken more of a sterilizing approach to the mouth, products touting that they kill 99.9% of germs. But now what we really know is this community is critical to our oral and overall health. And so our goal at Bristle is really to establish ways that we can manage balance within this diverse and balanced community between these beneficial bacteria and some of those pathogens that we do know. So when we look at interventions, we're really trying to get to the root cause of what's causing the symptoms. So if it's somebody who has tooth decay, for example, are we seeing an imbalance of tooth decay causing bacteria? So bacteria that digest our sugars in our diet and produce acid. Or are we seeing more gum inflammation related bacteria? So bacteria that live beneath the gum line and are actually triggering inflammation because these will end up necessitating different kinds of interventions. So, what we do see is that when we take more of that tailored approach and look at things from this community standpoint, instead of just trying to wipe everything out, that's where we can start to see this shift towards a more stable, healthy, beneficial bacteria dominated community. And so, for patients with tooth decay, for example, generally what we're looking at are can we incorporate something like a xylitol mouth rinse or remineralizing toothpaste with things like nanohydroxyapatite or arginine, and happy to dig in on every one of these ingredients and go as deep as you'd like. But retesting after the fact and then seeing that stable shift. And it lets us hone in on products that aren't just good at killing everything, but are really good at selectively targeting those pathogens and promoting the beneficial species.
Brilliant. Before we do a deep dive into the science and sort of the balance of the microbiome, can we give an example of someone who's done this test? We analyzed their microbiome, like implemented some changes, who actually saw a clinical benefit from this.
Yeah. So we have one patient in one case study that is a bit unique, but I think really highlights the power of the testing. So we have a patient who was actually brought to us by their physician. And this patient had been struggling with gum abscessing for years. They had seen multiple periodontal specialists, immunologists, infectious disease experts, and they actually tested their saliva. So they used other tests that looked for 13 common pathogens associated with disease, but everything kept coming back negative. So they ended up coming to us because they learned about Bristle and that we look at the complete microbiome. And in testing the patient, we actually found something interesting where they didn't have any of the gum disease bacteria, any of the tooth decay bacteria, but when we looked at their diversity, it was extremely low. They had over 75% of their microbiome dominated by a single pathogen, Serratia marcescens. And this species isn't commonly found in the oral microbiome. It's actually more found in tile grout. And so I think maybe it was picked up by the toothbrush or something. But, now we actually had something to go off. So we worked with their physician and dug into the literature and actually found that this species, Serratia marcescens, is extremely sensitive to xylitol. So rather than using antibiotics or some of these broader antimicrobials that hadn't worked, we put the patient on a regimen of xylitol and a Lactobacillus reuteri probiotic. And over time, in the course of, I believe, 5 to 6 months, we were actually able to completely eradicate that Serratia marcescens pathogen, and in turn also saw a dramatic shift towards a stable, healthier microbiome. So by clearing out that space and not relying on broad antimicrobials, we were able to get to that selectively targeting approach that we're all after with disease. And we have a great case study. Happy to link to it or share it wherever.
I'm guessing they had less abscesses as well.
Complete remission of abscesses. So they went from
Wow.
having, I think, monthly abscesses to over the first 6 months, they had one over 6 months. And then since then have been completely stable. So no abscesses, complete relief of symptoms. And they've continued testing with Bristle. And that's what's been exciting is actually seeing that stable shift maintain over time.
Wow, this is amazing. I want to go through some of the common conditions for clinicians that should kind of prompt them to consider testing like this for their patients. So I'm thinking things like gum disease, bad breath. Can you give us the short list that should really make someone consider recommending this test or considering this test for their client?
Yeah, absolutely. So the obvious ones, as you mentioned, gum disease, tooth decay, and halitosis. So halitosis or bad breath, I think often gets written off as just, something embarrassing or something to treat with mints, but we find it's actually often an early symptom of gum disease or of this imbalance where you have these microbes that are producing volatile sulfur compounds and leading to bad breath. Can also be extremely frustrating. So bad breath, we actually think is a great symptom to target, but some others that you might not be thinking about that we detect with our report are actually when we look at gut health. So it makes sense that the mouth is the start of our digestive tract, but more and more literature has shown that oral bacteria and the oral microbiome can actually have very direct impacts on gut health, on either exacerbating existing inflammation or possibly implying some causal or some types of other associations there. So we actually have a gut impact score on the Bristle test where we're measuring those bacteria that are associated with things like IBS, IBD, Crohn's disease, and see it as a great complement to some other gut tests and gut work. Another insight we give is related to nitric oxide. So, oral bacteria actually play a key role in converting nitrate from our diet into nitrite and then into nitric oxide. And so, with the Bristle report, we're actually able to look at the genes of the bacteria that we know cause or that we actually know are involved in creating nitric oxide from nitrate. So if you have somebody who you're doing work on with nasal breathing or otherwise trying to boost nitric oxide levels, you just had a great podcast with Dr. Birkins on nitric oxide and all its benefits. So that's another one. And some others that maybe are less obvious are the oral systemic associations
Mhm.
of oral microbiome imbalance. So even patients with autoimmunity, so patients with rheumatoid arthritis and autoimmune disease, I believe are 2 times as likely to have advanced gum disease. And certain oral bacteria actually can trigger autoimmune antibodies. Even patients who are trying to be very proactive about cognitive health, there's some really interesting literature showing associations between gum disease bacteria and Alzheimer's disease, and
Mm.
a lot of treatment programs focus on that now. So I know I'm throwing a lot at you there, but we really see the mouth as the gateway to the body and something that can really be managed and targeted for a number of different conditions.
Absolutely. And I think the ease of testing here is really important to consider. Testing for your gut microbiome can be a little daunting for some. Can you explain, like, how do you actually collect the sample? What's the process like for someone who does this test?
Yeah, so it really is just spitting into a tube. So within the Bristle test kit, what you'll have is a collection tube with a stabilizing reagent and a funnel. And so really all you'll do is just spit directly into the funnel, shake it up to stabilize the sample, and then ship it back to our lab. And that's basically it. So yeah, in contrast with stool testing, a bit easier, a bit, a bit less involved.
Well, and I guess I want to clarify for the person at home who's thinking, well, I do gut testing. So I already know what the person's microbiome is like. Why would I also do an oral microbiome test? Can you explain to folks why that would be theoretically, but also, like, what types of differences do you see in someone's oral microbiome? Or what are you looking that are different? What are you looking for that are different than a gut microbiome test?
Yeah. So, in terms of the actual species we're looking at, they're quite distinct. So, when we think of the oral cavity as compared to the gut, it's a really interesting niche in our bodies. Our teeth are the only part of our hard tissue that expand beyond our bodies. And with the gum line, we have very direct access to the bloodstream. So, when we have cuts, we have inflammation on the gums, it gives really easy access for these bacteria to then get into the bloodstream and travel around, which in literature we know they do. So on one hand, it's we're basically measuring a completely different niche that may present in the gut. We might find some oral bacteria there, but may also just be another source of inflammation that can be causing some of these other symptoms or triggering the systemic inflammation distinct from the gut itself. So we see it as a component of our digestive health, but in measuring the niche itself, we're able to get a lot of health insights that we just can't derive from the gut.
I would imagine the microbiomes are drastically different because what we're measuring in stool is coming from a completely different organ system, first of all, that really isn't exposed to a ton of oxygen regularly. Any saliva that we swallow is going through our stomach that has hydrochloric acid that is probably going to kill some oral bacteria. So, do you see that people's oral microbiome tends to look different than a stool test?
Yes, and in healthy patients, completely. Generally, we won't see colonization from oral bacteria in the gut in a healthy patient. And as you mentioned, we have a whole lot of defenses, and that's the reason why we have physical, chemical, immunological barriers that prevent that. What's interesting though is when we see patients who have inflammation or are on certain medications, that can actually make the gut more permeable to these hundreds of trillions of bacteria that we're swallowing every day. And so that's when we can actually start to see some of that relationship or start to see some of that similarity, which can be a red flag. So when we are seeing a lot of similarity between the gut and the oral cavity, that can point to something that we might want to investigate deeper.
Fascinating. Okay, so let's talk about tooth decay for a second. So I think there's a lot of folks who are in the category you described yourself in. Actually, a few minutes ago, I brush, I floss, I'm using the best products I can find. I'm doing mouthwash 3 times a day. And yet I still have a new cavity every time I go to the dentist. Are there microbes that we should be aware of that play a part in predisposing us to having cavities, even if we're doing everything right?
Yes, there are. So in the Bristle test, we're looking at 15 or 16 different bacteria that are associated with shifting towards that acidic environment or actually producing and causing that tooth decay. So for myself, for example, that was something I was very interested in when we first put the test together and made sure it worked, was seeing, did I have an overabundance of these cavity causing bacteria? And no surprise I did. So the next step is, what do we do to actually try and rebalance that microbiome? So xylitol, you heard me mention, is a great option there, but I think it goes so much deeper beyond just our hygiene. For me, this was a big learning that diet, we talk about avoiding sugar, which I think everybody knows, but arginine is actually, it seems to have an effect on the biofilm of the mouth that prevents adhesion or reduces biofilm formation of some of these cavity causing bacteria. So when we have folks who are struggling with tooth decay, xylitol is a great option, increasing arginine in your diet, and vitamin D. So low vitamin D is actually associated with decay as well. And for myself, I realized I was mouth breathing, which, we can go down a rabbit hole on that too. But when we're mouth breathing, it's drying out the environment. Saliva is one of our best defenses against tooth decay and against disease. So not only did I uncover what the root cause was, by doing so, I've had so many more tools at my disposal to then try and address my decay, which I since have, and I'm happy to report I have.
I love that. Well, so
Yeah.
what are some high arginine foods that we may mention and people might realize, like, oh, I don't really regularly consume any of those?
Yeah, so poultry, lentils, soybeans, pumpkin seeds, all great sources of arginine. And to get into it little deeper, so there's actually beneficial bacteria that reduce the arginine, or basically digest the arginine in the oral microbiome and release pH balancing molecules like ammonia, like nitrate, which is why we believe that's able to disrupt some of that biofilm formation and decay.
Wow. And then why xylitol?
So xylitol has a different sugar compound or chemical compound than sucrose, fructose, standard sugars. So the current hypothesis is that the bacteria try to digest it as they would a common sugar, but can't because of its chemical structure, which leads to them effectively starving and dying. So that's the current hypothesis on why, but study after study continues to support that xylitol either in your toothpaste or a mouth rinse, or I have just a little spray I'll use to further help try and combat dry mouth, all seem to be very effective against those decay causing species.
I know we're going to get asked about xylitol gum. Do you have a take on that?
We try not to go too strong on different brands. Definitely recommend working with your practitioner, checking on the ingredients. We have some ingredients or some brands we've worked with closely, like Feed Your Good Guys. They're a newer brand in the oral care space. Rise Well, Boca. A lot of these products have xylitol in a paste that I believe is at a lower quantity, because I know xylitol, there can be concerns about its impact on your gut health in particular. So I always want to be mindful there, and why we try to give suggestions beyond just xylitol. Because if you can't tolerate it, let's find something else that's going to work for you.
Brilliant. Okay, great. I would imagine that we could talk about products all day long. I have just like one general question for you, which is I see a lot of dentists saying now that some of the harsher mouthwashes that do say kill 99% of all the bugs in your mouth. Is that a viewpoint that you think is holistic and helpful, or do you have a slightly different goal with any mouthwashes that you do use now that you have all this experience and with the oral microbiome?
Mouthwash is a really fun topic. My take would be, and Bristol's take generally, is that we're on the right track. So we want to move away from mouth rinses generally that contain alcohol or generally are antimicrobial, because not only are we disrupting the microbiome on basically a daily basis, if we're thinking about the microbiome being a healthy forest or a healthy garden, we're effectively wiping the slate clean every day rather than nurturing it in a way we'd like to. So generally, we try and avoid using mouth rinses whenever possible, but we do think it has a good time. There's a time and a place for it. So if you are struggling with decay, for example, maybe a couple weeks with a xylitol rinse could be helpful, or something to help with dry mouth. If we're struggling with gum inflammation bacteria, there's some mouth rinses that are gentler on the beneficial bacteria, but selectively target some of those pathogenic species. So things that contain chlorine dioxide, for example. Or sometimes, we do have to go with more of the weed, seed, and feed approach, where we will recommend a mouth rinse that we can use for a couple weeks and then try to rebuild the microbiome with healthy diet, lifestyle, and intervention changes.
Brilliant. I can hear clinicians looking this test up already. And we talked a little bit about how simple it is to collect. Let's talk about, like how long does it take for someone to get their results back? And what does the results journey look like? Are they getting a pamphlet that guides them through each section? What's that experience like?
Yeah. So we basically, from when you take the saliva sample and it goes back to our lab, it's about 2 to 3 weeks from when you mail it back to when the results will appear online. Your clinician will receive them first and then can share them with the patient if they'd like. We made the report very patient friendly. So if somebody wants to go on and navigate, we have tons of information in there explaining what these different scores mean. And so to touch on the scores, we know it can be overwhelming to look at a report with 200, 800 bacteria on it. So what we do is we actually condense that information into 0 to 10 scores to give you a sense of your abundance of bacteria for each score. So things like halitosis or nitric oxide or beneficial or gum inflammation. But also, there's a lot of intricacies to how the microbiome interacts. So it's not as simple as do you have a lot of gum inflammation bacteria? Because there's one bacteria, for example, Fusobacterium nucleatum, that is in 95% of microbiomes. But if it doesn't have another bacteria there that makes it a bad actor, then it's not a problem. So we do a lot of that risk and kind of that cross species interaction analysis in that score. So when we're looking at it, you can use it as a risk score. But then if you want to go deeper, which I'm sure so many in your audience would like to, you can see the full breakdown of bacteria. We have nice descriptions of what they've been implicated in. Are they gram negative or gram positive, anaerobic? Are they sensitive to any particular probiotic strains, for example? So byproducts of different probiotic strains. And then we also will get into treatment recommendations. So, we've covered some of them here, but really trying to complete the loop there of in this report, giving you as much information as you would like, but then also helping you complete the circle there on what are the actual interventions that would be most effective for that patient.
We talked a lot about the bad actors. So the bacteria that, might be causing some damage or creating an inhospitable environment for the good bacteria. I'm curious as a provider, as I'm trying to rebalance someone's oral microbiome, can I do things like have someone consume foods with prebiotics or swallow a probiotic pill? Or is it more likely that I'm going to have someone do a probiotic swish? Like, talk to us a little bit about how we boost the amount of good bacteria in the mouth.
All right, great. One of my favorite topics. So, diet is obviously a great starting point. So, probiotics, prebiotics, all great to get into. One of the most effective things we can do is just increase nitrate in our diet. So, this is in things like beets, leafy greens, beetroot juice supplements. Nitrate is actually a prebiotic for a lot of those beneficial bacteria. Additionally, just optimal diet, things like omega 3s, vitamin D, we touched on earlier, all help boost the immune system, which interplay with some of those beneficial bacteria. Oral probiotics, which is another topic we love, is generally what we see is the most effective oral probiotics are locally administered. So, oral probiotics, what you'll typically see are more of in a breath mint or a lozenge format, where we're actually able to introduce those probiotic species directly into the oral cavity. And then from there, they're actually able to get to work on releasing bacteriocins, which are natural antimicrobials, possibly colonizing in the cavity, but really trying to knock down those pathogens. And in turn, we see some interesting interplay where a species, so Streptococcus salivarius, M18 and K12 is one probiotic strain. Not only does it seem to reduce certain decay-related pathogens, it also seems to increase the growth of beneficial or more commensal Streptococcus species. So the garden analogy is one we come back to a lot because you have this finite space, and by creating that environment and creating space for the commensals to grow, along with some of those dietary interventions and probiotics, that's how we can open up the space for them to come in and really start to take over and get that balance we're looking for.
Wow. Okay, you just said probiotic lozenges and mints?
Yeah.
Okay, I know you're brand agnostic, but I am guessing a lot of providers may not have even known that those existed before a minute ago. And so, yeah, can you walk us through some products that you feel like are might be newer on the market and that doctors may not even understand are available to their clients to help shift their oral microbiome?
Yeah. So oral probiotics, it was as we were getting into the space, it was something we really wanted to spend a lot of time on because we know gut probiotics are much more popular in the zeitgeist. And we saw that some oral probiotics were just trying to repurpose gut species. But it's not, we know it's a different niche, it's a different community, and some of them are actually leading to decay or could actually cause more of an acidic environment, which we know is terrible for the mouth. So we spent a lot of time, and we have a great research article we can link to as well, but digging into what some of these species are that have been found to be effective for different conditions. So I can run through the strains if that'd be helpful. We can also just touch on some brands. So we actually have our own probiotic where we compiled the 6 strains we found to be most effective against gum inflammation and halitosis. There's some other great products out there like Super Teeth, BioGaia, Bliss. Basically, they're all different combinations of probiotic strains that are effective at different things. So some are more effective for halitosis, some are more effective for gum disease, some are more effective for decay. And so really, when we're looking at some of these oral probiotics and why we wanted to put that in the Bristle test is help you figure out, should I be using this probiotic or should I be using this one to really make sure we're introducing things that are most effective for your patient.
That's incredible. I am curious, like, my guess is that researchers are coming to you guys, that people who want to develop new products are coming to you guys because you probably have so much before and after data that is really clinically valuable that, to my knowledge, we've really never had in medicine or dentistry until now.
Exactly. Yeah. Data has been, the lack of research has really been a crisis, I think, in the dental space. There's so many products, there's so many claims, but we aren't actually looking at how they modulate the root cause of these conditions. For so long, we were happy to just eradicate everything. And, a point I meant to mention earlier on the mouthwash is when we eradicate everything, we actually see increased rates of hypertension. So people who use antimicrobial mouth rinses every day actually are at a higher risk of hypertension than folks who don't. And part of that's due to the nitric oxide producing function of the oral microbiome. But that's where we get so excited to work with clinicians is it's really going to take a village for us to get this information and figure out what's working. And we're still a small team, so we're doing our best to try and run these studies and see what we can. But that's where it gets exciting to, do some citizen science and actually look at across this population, we introduce this, we're seeing a shift here. That's great, and doing it with consumers is awesome. It's something we've done in the past where, we have some fun studies on how an electric toothbrush is effective versus a manual toothbrush. But with clinicians, we can get that really strong data and start to see in dentistry and beyond, how can we really do a better job of setting patients up for success?
Wow, this is so cool. Wait, I want to know the answer to the electric toothbrush versus manual.
So we actually found that electric toothbrushes were more effective at reducing the gum inflammation and decay bacteria. And interestingly, we saw an increase in commensal bacteria, so in our beneficial bacteria. So yeah, probably part of it is that because it's a little more effective at disrupting the biofilm, that opens up the space for the commensals. But, that was really cool to see. Even flossing, there hasn't been a really strong randomized clinical control on flossing. So some people just don't think you have to do it. And we actually saw a stepwise function where if you flossed 3 times a week or less versus 4 times a week versus 7 times a week, you can see that stepwise reduction in those gum inflammation bacteria. So,
Wow.
you know, proof's in the pudding.
I
Yeah.
love that. Okay, now I have to dig
Yeah.
deeper. Did you specify whether it was like the circular rotating electrical toothbrushes or the ones that vibrate?
We didn't get in that deep. We'll have to do a follow up
Yeah.
study on there. Yeah.
Okay, I need to know.
Generally, yeah. anything that you're brushing twice a day is better than anything you're not.
Fair.
But then from there, there's room for these improvements, and we want to run the study. So
I
yeah,
love
that's a
that.
fun one.
Yeah.
Mhm.
Okay. Let's drill back into hypertension for a second. So, can we quantify this a bit? I can see someone at home thinking, "Well, I'm not going to give up my Listerine, and I'm sure it's like 1 point for my systolic blood pressure that it would make a difference." Do we have like what would you say to a person like that? Like, can it actually make a meaningful difference if someone either decides not to use a mouthwash or stops using a mouthwash? Can we see a meaningful difference in their hypertension?
So studies have shown that. Yeah, we can. We have another. We love writing research articles because our claims are suspect if you haven't heard them before. But there were at least 5 different studies I'm aware of where they measured actually the blood pressure and actually looked at the microbiome of patients or of folks in the study who were using this mouth rinse, these broad spectrum mouth rinses, and weren't. And there were measurable differences both in the blood pressure of the patients as well as in the abundance of those species. So species like Rothia, Strep sanguinis, Neisseria. There's these particular microbes that, from our analysis, we know actually have the genes to digest nitrate into nitric oxide, and saw those reductions in patients who were using the mouth rinse every day. So I don't have the strict numbers. I'll have to follow up with you there because I want to make sure we get that info. But yeah, it has been pretty well.
Wow. Okay. Let's talk about cardiovascular health as a whole. So, I think a lot of people know, like, all right, if you have a heart condition, you take antibiotics before you go get any sort of invasive dental procedure. But their understanding of how the microbiome in the mouth is linked to cardiovascular disease might end there. What's missing from that understanding that you wish more people knew?
Yeah. So, the one we just touched on obviously is looking at the nitric oxide and what that can do for blood pressure. And we know nitric oxide is involved in cardiovascular health as well. But we also see some really strong associative relationships between oral disease, so particularly gum disease and advanced gum disease, and heart disease. And generally, for a lot of these oral systemic connections, what we've seen are both direct relationships, so kind of more direct implications and more indirect implications. So, direct implications would be where we've actually seen and found oral bacteria in the tissues around the body. So, for example, in infective endocarditis, we've actually know bacteremia can be an increased risk factor there, and oral bacteria have been found in tissue from the heart and from around the rest of the body. On the indirect side, what we're looking for is how oral bacteria and gum disease actually recruit immune cells, so generally Th17 cells or other types of immune cells, which then prime the body into more of a hyperinflamed state. And so from that inflammation, we know when we have chronic inflammation anywhere in the body that it's going to start increasing our risk of um, systemic conditions. And so when we're looking at it, it's really from those two angles generally.
I love that this test exists and that it's so available now, particularly for practitioners to order, and especially so proud that it's on the Rupa Health platform. I think one of the frustrations for me as a clinician was somebody would come in to see me, their CRP would be elevated. I'd send them to a dentist to assess for infection. And sometimes they would come back and say, the doc didn't find anything. I don't have any cavities. My x ray looked clear. So, can we chat with folks about what bristle might show them that's different than what they may hear at the dentist?
Yeah, and we're really lucky to work with just an incredible community of dentists. You know, functional medicine has been such a great force on, I think, health, and functional dentistry is really starting to catch up. We see some great leaders in the space. You had Stacy Whitman on, Dr. Mark Brahen is one of our advisors, who's another big leader in this space. And so, if you went to one of those appointments where they're actually oral microbiome testing versus what you'd get in a traditional visit, you're going to hear some distinct differences. And I think the biggest thing is when we go to a traditional dental visit, we're looking for bleeding on probing is one of the key factors. So has the infection gotten to a place where it bleeds when you poke it? or looking at pocket depth, so actually how severe is that infection based on these physical manifestations. But what we're able to look at with the bristle test is actually what is the underlying biology there. How advanced is this infection? Are we seeing someone who has some abundance of commensal bacteria and then has an elevated level of these bacteria that cause gum disease? Or are we seeing a patient who has no commensal bacteria and has extremely high levels of gum disease? Because what we'll see is those patients will generally advance disease at a very different pace. So they're at very different risk of that infection. So, even if they're not able to detect it from those physical manifestations, it doesn't necessarily mean they're not there. You might just have a better immune system at fending off the infection in the mouth. But if we still are seeing those high levels of pathogens, it's a great opportunity to get out ahead of that, really trying to move towards preventative dentistry, where we can start to address these imbalances before they cause disease. If you went to your primary care physician and they didn't run a blood test, you'd probably find another primary care physician. But that's really what the shift we're starting to see in dentistry.
It seems like a very functional medicine, whole person approach that's based on data that really does give you a lot of information earlier before there are structural changes. And so this is a great addition to your current dental care or the current dental care that your clients are getting for the folks at home who are listening. I love the way you worded that. I think there's so many directions we could go with this. You mentioned something in the beginning that really caught my ear and probably the ears of the other clinicians who are listening, which is that you mentioned autoimmune disease and the link between oral microbiome disruptions and autoimmune disorders. Can we drill into that a bit? What particular changes in the oral microbiome might we see that could contribute to either the development or symptoms that we see in autoimmune disease?
Yeah. And so just want to be clear, this is still an emerging science and something that needs more research behind it. But from the early studies, what they've found is that patients with autoimmune disease tend to have distinct oral microbiomes compared to healthy patients. In particular, they tend to have higher levels of the bacteria that produce or that lead to gum disease, or more commonly associated with gum disease. So species like Porphyromonas gingivalis, Prevotella intermedia, as well as a few others, actually have specific epitopes that can trigger autoimmune antibodies. So generally, if we're working with someone, and we have some anecdotal cases, we have a great practitioner we work with, functional medicine practitioner, who has seen in her patients, she said that when she manages and gets the oral microbiome under control, that they start to see relief of symptoms, not complete eradication. That's eventually the goal, but at least relief. That if we can control some of that inflammation, that we'll see some of that reduction. Again, anecdotal, and something I'd really like to see replicated, and something we at Bristle are very passionate about is, can we start to get more funding behind some of those studies? Because autoimmune patients, we really are not giving them the proper care, I think, as a healthcare system. And so any other avenues we can be looking into, we should be pursuing.
I agree with you completely. I think our existing interventions for autoimmune disorders are usually pretty high on the therapeutic order, meaning that they tend to come with some serious side effects. And I think as much training as I've had about like addressing gut health and consuming a healthy diet and a diet that is low in potential immune system triggers for people with autoimmune disease, I really haven't heard a ton about the oral microbiome until you guys. And so I think it's a brilliant connection that is totally worth exploring. And you guys are making it easy to do that. And I love hearing some of the anecdotal experience of other docs. And I know our audience does as well. So I'm really glad that you shared that. I'm curious, I want to circle back to CRP for a second. Do you have any anecdotal evidence? Like, have you heard of a doc seeing a client with elevated CRP, looking at their oral microbiome, addressing whatever they saw there and seeing markers of inflammation come down in the blood? And it's okay if you haven't, but I'm fascinated and I couldn't wait to ask you this.
So, not off the top of my head. It sounds like something we'll probably need to be doing. Maybe we'll have to collab and get you some bristle test kits and start measuring that. We're working with a dentist who's just started a cardiac clearance study. So basically, patients are being referred to her to be cleared prior to treatment, and so she's bristle testing all of those patients. So hopefully, we'll be able to start to see some signatures or actually start to see, are we seeing certain elevated levels of individual microbes or specific community shifts? So more to come, but you should do it.
What I'm feeling and what I think our listeners are probably feeling is like, it sounds like you guys have an entire ecosystem built out. Like, not only are you going to improve your own health potentially when you take this test, but you're part of a really cool movement to start to add to the research and the literature and just the data around the oral microbiome, symptoms, and then other health conditions. So, can you talk to me about ways that folks can get in touch with you or learn from you? You mentioned you have a ton of studies. What does it look like to be someone who's learning alongside Bristle and who's kind of part of this journey?
Yeah. So, as you mentioned, we've been really, really lucky with just finding people and people finding us who are passionate about advancing patient care. And we're really standing on the shoulders of giants here. And it's really through that partnership that we're going to get to where we're hoping to get to, which is a healthier community and a healthier population via managing the microbiome. So, working with us, we love working with practitioners. We have training programs where, when you get your first results back, we love going through them together, making sure that you're very comfortable with what the findings are. We've built out this community of more functionally minded dentists and practitioners where, we're really trying to enable some more of those referrals and knock down some of these silos that have been created between oral health and overall care. And then we just love creating resources and sharing information. So we have a really built out blog on any type of oral systemic connection you might be interested in. As we learn new things, we share it through our newsletter. And, being able to work with a partner like Rupa Health with the incredible community you all have built, we're so excited because now we get to work together and really make the mouth a lot more accessible as a medium for trying to improve patient care.
Absolutely. We are thrilled to do this. This has been an awesome interview, but if you don't mind, I'd love to ask you a few more questions.
Fire away.
Okay,
Yeah.
cool. First, we talked about some foods, and I'm curious how your own view of nutrition has changed as a result of learning about this science, co-founding Bristle. Like, when someone asks you, what's a healthy diet? How has your answer changed in the last few years as a result of what you've learned?
Yeah. I mean, diet's really one of those things where once you start learning about it, you can't put Pandora back in the box, right? I think it's just food as medicine has obviously exploded. And I think for good reason. We developed our relationship with food from the beginning. It's our most accessible medium and probably our most bioavailable medium for a lot of the nutrients we need and a lot of, just what we need to stay healthy. From the oral health mindset, one of the biggest things has just been this evolution in thinking about diet and its interplay with our oral health. We've had such a simplistic education and understanding of avoiding sugar and, trying to cut back on simple carbs, things like goldfish crackers, the like that are sticky carbs can be very detrimental. But I really think the other facet of it that has really opened my eyes and I think holds a lot of patient promise and a lot more promise for better outcomes is thinking about how we can be proactive through diet for feeding those beneficial bacteria and, actually having good options for patients on if we want to focus on high gum inflammation, looking at things like nitrate and omega 3s, or if we have high tooth decay, looking at things like arginine and vitamin D to really be one of our best levers in actually managing the health of our microbiome.
Additionally, I want to know from you, because I love the way that you describe the science and how inclusive Bristle Health is of this entire journey, right? It's like, how can we just kind of like add more comprehensive data to someone who's just looking to explore their oral microbiome, who's also working with other care providers on existing health conditions? If you could wave a magic wand and change something about the way we're either doing oral health care or consuming certain foods, like, I gave you one wish for how you could change things that would improve everybody's oral health, what would you do?
What a fun question. Um, my starting point would be education. We just have such a problem with oral health education in this country, and I'd say globally, in terms of not just its what we can do to improve our oral health, but really its impact on our oral and overall health. And as someone who's spent way too much money on my mouth, the real impact it can have on patient lives. I think that's one of the really exciting things since starting Bristle is when we have patients who've struggled with oral health and finally can look at what's happening and learn about it. We survey everyone. They end up 85% plus of people who take Bristle test end up reporting acting on the recommendations. So end up adopting flossing or making a dietary intervention, which, that's the real power. There's only so much your care team can really do. A lot of it does fall on the patient at the end of the day to make those behavioral changes. And I think once you have that aha moment, as we were talking about with diet, it's something that sticks. So I guess I'd have to go with that. If I could pick a second one, it would be figuring out how we can better integrate oral care with the rest of our healthcare system, because it's just this completely artificial divide of something that's so important. And from functional medicine, the one lesson we've learned is that you can't be treating things in silo and expect them to get better. And, we get to work with really incredible practitioners who have their partners on the primary care side or on the functional medicine side, where they're sending patients back and forth and looking at all the different analytes and understanding that to really treat gum disease, we need to help improve the patient's immune health. And how do we do that? What are the other things we're looking at there? Other interventions we can incorporate to really set them up for success. So I changed the answer. I took two magic wands, but hope you'll allow me to do that.
I love it. I mean, I think you're kind of already waving that first magic wand in a way by making this data available to people at a really affordable price and a really accessible collection method. So this is something that most people can afford. I mean, I know we're proud at Rupa Health to give people the 3-month interest-free payment plan who need to do that to afford a test. And you're putting these results in people's hands in a way that they can truly understand and that their doctors can truly understand and team up with them with. I want to ask you one more thing before we go, because I know my docs are going to ask you this if I don't ask you. We mentioned how the oral microbiome is distinct from the gut microbiome, but I'm curious to talk about the insights that you might get about your gut health or gut disorders when you do this oral microbiome test that we may not have mentioned already that you would want clinicians to be aware of?
Yeah, I think part of it is really, I will never say this could substitute for a gut health test. GI map, some of these other options that are available through Rupa are fantastic options to really understand what's happening in the gut ecosystem. But what you can understand is, are you dealing with something? So basically, if we're trying to address gut inflammation, but we have chronic inflammation coming from the mouth, you're going to be having a much harder task if we're not simultaneously trying to address what's happening in the mouth. So being able to run this test, we can actually see, do we see that imbalance? Do we see some species like Campylobacter or Fusobacterium nucleatum or P. gingivalis? A lot of these names I've already said that are associated with things like IBS, IBD, Crohn's? Or do we see that inflammation where for SIBO, there's fewer studies connecting oral bacteria to SIBO, but what the literature is implying is that when the oral cavity is attracting much more of these Th17 immune cells, it seems to reduce them from the small intestines. And so with that being the case, could that allow for bacterial overgrowth? So, still an emerging science. I'm going to keep saying that just because we have a lot to learn. But, I think on one part, it's really just understanding from a digestive health standpoint rather than just a gut health standpoint. Where is that patient at from a health standpoint?
Amazing. I know clinicians are going to go look at this test, order this test, try it for themselves, their family. I'm curious, what do you think we missed in this podcast, or did we miss anything that you really want people to know?
I would say this has been an incredible conversation. You're a fantastic host. Thank you so much for all the great questions. Yeah, I mean, I guess the only other thing would be wanting to be mindful about how we do the education of the oral systemic connection. So, I always just want to make sure we're very out forward saying a lot of these are associations. And we don't want to say that by addressing the oral microbiome, you're going to completely reduce risk of disease or cure any of these conditions. But we can at least start to think that given all these associations and given about what we know about biology, that by managing the oral cavity, we can at least be setting ourselves up for success, which I think is all we can ask for a lot of the times longer term. So just want to add that little tidbit in.
I love that. And I think that's why practitioners trust you guys so much because you back everything that you say up with evidence. You're very transparent about the level of that evidence, which means that practitioners can really feel confident, not only trusting the interpretive report that they're reading, but knowing that you're caring for their clients as their client is reading that as well. So they're not being overpromised something. They're truly understanding the science, getting informed consent about any interventions they may choose to explore with their doctor. I think this is an incredible tool, not only for doctors and patients individually, but for them to use together to just improve their whole health journey. So, thank you so much for co founding Bristle Health. Thank you for partnering with Rupa Health. I cannot wait to do more education with you guys.
Thank you for having me. Like I said, we're so honored to be on here and to be working with you all at Rupa. We have a lot of work to do in healthcare, but it's through partnerships like this and with all of the practitioners you all are working with and we're all now working with that we're really going to get where we need to. Of
I love it. We'll do it together. Thank you so much for being here today.
course, thank you.